Hello, this is Dr. Dana Brackney, and I'm an associate professor in the Department of Nursing at Appalachian State University. The objective of this presentation is that the student will value positive personal regard as the foundation of motivational interviewing. The spirit of motivational interviewing is central to understanding behavior change. We do not change people. They find within themselves the resources to change. The spirit of motivational interviewing is consistent with our professional values of human dignity and self-determination. Both of these values are evident in the practice of motivational interviewing. The spirit of MI respects human dignity by being collaborative. One way to implement the spirit of motivational interviewing and demonstrate respect is to ask permission before discussing a health behavior topic. This means that the results of substance use screening is not just presented to a patient. Instead, the health professional asks, would it be okay with you if I provided you with information from the alcohol screening you just completed? This question prevents the assumption that your information is more important than the person's own choice to hear or not to hear the information. The healthcare professional can ask more questions if resistance to hearing results is presented, and most importantly, listen and roll with the person's response. The not so simple act of listening and of asking permission demonstrate compassion, respect, and collaboration. The spirit of motivational interviewing is also evoking the person's own reasons for change. The careful listener will often hear ambivalence and desires, hopes, and dreams in the responses of clients. These responses then are further discussed to focus the client encounter on topics of interest to the individual, thereby respecting the person's autonomy. These are the tasks of motivational interviewing: engaging, focusing, evoking, and negotiating plans. The screening tools provide an opening to ask permission to engage in a discussion about substance use. Open-ended questions are often used when engaging a person to talk about their own values and experiences. Next, the health professional focuses the conversation on what's important to their client. Healthcare professionals listen for change talk throughout the conversation. Questions about how likely someone is to make a change, followed by why not a lower number, often evoke a person to state their own motivation to change. Finally, helping the person to make a plan and setting up a follow-up appointment or a warm handoff to another professional completes the tasks of motivational interviewing. There are 4 principles to keep in mind as you engage with a client. First, the health professional needs to express empathy with the person's situation, experience. This empathy builds trust and helps the health professional to remain humble in their demeanor. For example, I'm so sorry that you've been feeling so down recently. Secondly, a discrepancy between the client's own values needs to be identified to facilitate change. Here are 3 discrepancy building examples. So, I hear that you want to be more supportive of your son by attending his ball games, but it sounds like your drinking's getting in the way of attending. Is that correct? Another one. So, do I understand you correctly? You said you want to go on vacation, but the money you're spending on pills and alcohol keeps eating up your savings? Or a third. So, I hear that your friends mean a lot to you, but you're concerned about your health and safety if you keep on drinking so much with them. The third principle is to roll with resistance. This means if a person is objecting to facts that you share, you do not argue with their resistance. You do not object to their continuing on with their behavior. You place more value on the relationship you're building than on making someone behave or believe your own truth. An example of rolling resistance is, "You just don't know how to have fun, do you? My drinking's never hurt anyone." In response, the provider can say, "I am glad you do not want to hurt anyone. Would you like to hear about my concerns that you could be hurting yourself?" Rolling with resistance helps the person to not, quote, dig in their heels. Our value of autonomy and self-determination prevents us from forcing someone to take a particular action or subscribe to a particular health belief, as if we could ever force them to do that. Finally, the fourth principle, self-efficacy, is supported in motivational interviewing by identifying, supporting, and affirming the client's positive values and health choices. Well, now it's going to be your turn. Think of a change that you've made, tried to make, or are making, or are planning to make. Take a moment, pull out a piece of paper, and write down your thoughts. What led to your decision to consider making this change? Write it down. How did it go? Or how is it going? How would the outcome have been different or similar if you had had someone helping you with this change who demonstrated the spirit of motivational interviewing? Did you experience the tasks of MI, engaging, focusing, evoking, and planning? What if someone had helped you by embodying the principles of motivation of interviewing with empathy, developing discrepancy, rolling with your resistance, and supporting your self-efficacy? Be thinking about these ideas as you go through your day. I hope that this reflection helps you to value the positive personal regard that is at the core of the spirit of motivational interviewing.